Today's paper. By Henjong Han. Today's paper is, Pediatric Genomics, Diagnosing Rare Disease in Children. Published in 2018. This article reviews the application of genomics to pediatric rare disease diagnosis. Following the previous video, today I will cover the second half of this article. Considerations for clinical application, and future perspectives. Okay, let's begin. The third topic, considerations for clinical application. Clinical expertise. Establishing a robust diagnosis requires various fields of clinical expertise. In order to establish a genetic diagnosis for a rare disease, the integration and correlation of genomic data and clinical features are required. It is also important to assess if the patient has a single or blended phenotype. Making a lifelong genetic diagnosis is important for the patient and the family. And it requires a review of recent studies, additional clinical evaluations, and investigations. Expertise can also evaluate if the candidate variants represent a robust genetic diagnosis. In addition, as technology advances, reanalysis of existing NGS data can increase the diagnostic rate. Who to test? It is important to choose a patient who really needs genomic testing. The NGS investigations should be recommended to patients with a high index of clinical suspicion of genetic disorders. The correct application of genetic diagnosis can alter the clinical managements for patients. The study in 2012 showed that the application of whole exome sequencing to 32 patients have altered the diagnosis and clinical care in 72% of the patients. Next, test selection. NGS-based genetic tests seems to be a better method, but it is not always recommended. In the cases of the infants with fat malabsorption, a single gene test of CFTR gene is recommended, not the NGS test. That is, the whole exome or whole genome sequencing is recommended only for diseases with broader locus heterogeneity. Also, whole genome sequencing seems to be a better technology than whole exome sequencing, but it is not always effective. Since the price of whole genome sequencing is 3 times expensive as the price of whole exome sequencing, it is recommended to performing whole exome sequencing for family trio than performing WGS once. Next, complexity. We wish that a disease is caused by a single genetic cause, but it is a rare case. In the most cases, even for patients with a single diagnosis, a gene with major effects may act in concert with multiple variants with modest and minor effects. The combined effect of these variants influences the penetrance and expressivity of the disease. In the future, it would be possible to integrate those data and understand the genetic complexity of the disease. Next, value. There are many benefits of an accurate genetic diagnosis. 1. Better understanding of prognosis. 2. More tailored management. 3. Improved surveillance. 4. Accurate genetic advices. 5. Improved access to education and healthcare. 6. Resources of expert advices. 7. Shorten the time to diagnosis. 8. Personalized treatments. For example, in the study in 2016, the whole exome sequencing of patients with neurometabolic disorders led to a diagnosis in 68% of them and suggested a change in treatment for 44%. Next topic, future perspectives. Improved implementation of pediatric genomics workflows. The field of pediatric genomics is just beginning to develop. There are many aspects of the workflow that need to evolve. 1. Clinicians are learning where to put the genomic investigation. 2. Sequencing companies are developing more accurate technologies. 3. Bioinformaticians are improving many algorithms. 4. Population databases are growing. 5. Gene discovery continues apace. 6. Databases and literature continue to grow and improve. All have important roles in improving accurate genetic diagnosis. Next, integrating multiomics data to improve diagnostic ability. There are applications of NGS technologies other than in genomics. Transcriptomics, epigenomics, metabolomics, and proteomics. These fields can provide insights in functional impact of genetic variations, but not yet implemented in a diagnostic settings currently. If we can implement these data along with genomic data, it is possible to guide the genomic reanalysis. For example, in the study in 2017, the use of transcriptome data with genomic data have identified candidate variants from 21% of patients, who have no strong candidates only with genomic data. Application of genomics to diagnose fetal, neonatal and adult disease. Currently, the genomic diagnosis is mainly focused on pediatric than in fetal, neonatal, and adults. There are several reasons for this. First, the phenotypic features in fetal and neonatal are usually fewer and less specific. So, if affects the ability to discriminate candidate variants, which make the diagnostic rates. In the case of adults, it is also difficult because of the incomplete and age-dependent penetrance. Also, environmental factors are more important in adults. And, age-related somatic variance affects to late-onset disease. In the future, with improved knowledge, the application of genomic diagnosis would be more feasible in these age groups. Next, from diagnosis to treatment. Eventually, after accurate diagnosis, we need a proper therapeutics. There is an example of twins with severe dystonia. NGS analysis of the twins found biallelic variants in SPR gene, which led to the treatment supplemented with 5-hydroxytryptophan. And then, their condition improved dramatically. NGS analysis can also stratify patients for therapy. In 2017, patients with cystic fibrosis underwent NGS analysis. Among them, patients with homozygous mutations of CFTR gene had improved efficacy of combination therapy with lumacraftor and ivacraftor. The combination therapy to patient with homozygous mutation improved lung function, compared to control patients. In the future, therapy using CRISPR-Cas9 may be a reality for patients. The genome editing technologies are improving continuously, and this kind of ex vivo approach may be feasible for patients soon enough. Okay, to sum up. First, considerations for clinical application. 1. Clinical expertise is necessary for robust genomic diagnosis. 2. Not all patients are recommended with NGS-based genomic tests. 3. Many factors affect the choice of test. 4. Genetic complexity influences the variability of disease. 5. Accurate genetic diagnosis provides many benefits to patients. Next, future perspectives. 1. Many aspects of pediatric genomic diagnosis needs to evolve. 2. Integrated analysis of multiomics data will provide additional insights. 3. It is challenging to apply genomics to diagnose fetal, neonatal and adult disease. 4. The main goal of genomic diagnosis is developing therapeutics. This is a review article and covers much details in each fields, so I might miss a lot of information from the article. I strongly recommend you to read the original paper to learn more. Thanks for watching this video. Please like and subscribe and click the bell icon to get new video updates. See you next time. Bye.